Okay, everybody, looks like we're going to go ahead and get started now. So again, welcome to the Seismic Compliance Plan and Delays Beyond the 2030 Deadline webinar, brought to you by the Department of Healthcare Access and Information, otherwise known as HCAI. You may download the handouts for today's presentation in the Go-To panel under the, it may say Materials section or Handouts section. We're scheduled to be here for 2 hours today, and we will have a short 5-minute break at approximately 11 o'clock. We have a lot of information to cover, so we will not have time for a question and answer session during the webinar. But if you have any questions during the presentation, please email them to seismiccomplianceunit@hcai.ca.gov. That's seismiccomplianceunit@hcai.ca.gov. If you experience any transmission difficulties during the presentation, please log out and log back in using the login information that was sent to you by GoTo when you registered for the presentation. Today's presenter is Ollie Sumer. He is the supervisor for the Seismic Compliance Unit. Once again, thank you for joining us today, and I'll now hand the presentation over to Ollie.
Thanks, Kelly. Good morning, everyone. So this is quite a topic where it truly affects a lot of facilities. So we'll talk about the new developments on seismic compliance plan, and we will talk about the delays beyond the 2030 deadline due to AB 869. So before I go to the next slide, I'd like to actually thank a lot of people who really worked on this behind the scenes. I'd like to thank Seismic Compliance Unit members, Structural Services Section members, Building Standard Unit members, Hospital Building Safety Board, Feedback, California Building Standards Commission, and our wonderful IT development team. So it's truly a big team behind these two items. With that, I'll go to my next slide. So just a little advertisement. So today's webinar is the Seismic Compliance Plan and Delays Beyond the 2030 Deadline. A couple of weeks ago, we did Seismic Grants, Small and Rural Hospital Relief Program. So if you missed that one, we'll be, if not already, we'll be basically putting our recording and the handouts. In a couple of weeks, we will be talking about MPC compliance. So we'll give updates on latest and greatest, frequently asked questions, some construction items, and how to actually manage the nature of MPC with all the other things ongoing. We'll have a more specialized session about a couple of weeks after that, water rationing plan. This is an MPC 5 topic. Again, a lot of questions, so we will share with some common issues, some construction questions. So it's gonna truly be specific to this topic. And following that, a week later than that, we'll talk about SPC. And SPC will touch on SPC 4D upgrades or removing the acute care services so that it's basically going the other way around on the retrofit side. So we'll talk about those and some common issues, some suggestions, and then after April 2nd, we are lining up with some other webinars. So stay tuned, and if you haven't subscribed our email list, please do, and you will get all the updates about these webinars. All right, I just wanted to talk about a quick outline of what you're gonna see today. I will first start with the overall summary of the entire presentation. So in that slide, you should be able to basically understand the very fundamentals of everything. So I'll try to summarize everything in one page so that that will be probably the big takeaway. And then I'll just jump to our efforts to implement AB 869. And then right after that, our brand new PIN 80, it just being published today. I'll talk about that. And I'll straight go to the flow charts to show you the whole process of seismic compliance and the delay. And then right after that, I'll go through step-by-step application process for both. So since these two are new, I'd like to basically go through step by step so there's full clarity. All right, now going to the summary. So two big items. One is seismic compliance plan application. The second thing is delay application. Seismic compliance plan application is nothing new. It's an old requirement back in 2001. We just came up with a new interface. So it's automated, it's interactive. So this is our new tool. What is seismic compliance plan? There are a lot of misconceptions about what it means. Basically, it is a super simple 2 brief tables that identify seismic scope and schedule to achieve compliance. That's pretty much it. It's required for all hospitals, and the deadline to submit is January 1st, 2026. Again, this applies to all hospitals. The second part is the delay application. This is under AB 869. So this delay is basically delay to 2030 application or 30 deadline up to 2033, and the delay date should match what the seismic compliance plan says as a final deadline. So it should match. This delay application has a few documentation required for eligibility verification, and only eligible hospitals can apply. And the deadline to submit is the same as seismic compliance plan application. And again, this doesn't apply to all hospitals, only eligible hospitals. Now, the takeaway is if you're going to seek delay, you need to submit both delay application and seismic compliance plan application. If you're not seeking delay, you should only put seismic compliance plan application by 1/1/2026. That's the big summary. All right, jumping to AB 869. Last year, end of September, bill got signed, and this is the summary of the whole bill. A high-level summary. There are several details, but so it's a 3-year delay to 2030 seismic compliance deadline for this type of hospitals: distress hospital loan program recipient, a small hospital, a rural hospital, a critical access hospital, or a healthcare district hospital, with some exceptions. So these are what we call the potential eligible type hospitals. And there's an additional requirement about submittal of required MPC reports. And the required MPC reports are no later than 1/1/2025 for each non-compliant building. And the submittal of seismic compliance plan by 1/1/2026. So seismic compliance plan has milestones in it. HCAI has 120 days to approve, deny, review, and I'll come to that one. If denied, hospitals can actually remedy the deficiencies laid out in the denial letter or remarks letter. Milestones are key for seismic compliance plan. I will talk about that in detail. And there's an additional 2-year delay, and this is with HCAI's discretion. And these are for circumstances beyond hospital's control. So there's accountability measures to make sure that the deadlines are met, and those are come with fines and delaying issuing permit for the whole facility if the milestones are missed. So after the signature last year, we basically worked on regulations, and within a month or so, we put together set of regulations. We issued for public comment in early November last year. So again, a big thank you to California Building Standards Code and the Commission for true collaboration on this submittal. So typically a code cycle takes about a year and a half. For emergency authorizations, maybe 6 months. So our process, again, with the collaboration of with the commission, it was truly a very short time. So those proposed changes, while we are getting public comments, we presented this in the Hospital Building Safety Board. And after that, we also sent letters to potential eligible facilities for awareness that this is what's going on, about 130 facilities that we identified. California Building Standards Commission gave actually final approval, and happy to say that final express terms were filed with the Secretary of State on February 27th, actually a few days ago, about a week ago, which means that 30 days after this filing, the regulations will become effective, which is March 29, 2025. For those of you who are in the regulation world, you may say, wait a minute, 2025 codes become effective 1/1/2026. That is true, except California Administrative Code has this earlier effective date. So again, that's March 29, 2025. So since the final express terms were filed, now we were able to publish the PIN. Actually, it should be on right now, if not in an hour or so, on our website. So you should be able to download and take a look at it. A lot of this presentation materials are from that PIN 80. So again, it really goes in detail to the streamlined seismic compliance plan application and the new seismic delay application. So, and those two are applications also opened today or yesterday. So talked about this. The role in PIN 80, we go through again each item for seismic compliance plan and the delay, and the emphasis is again submit both so that we not only understand the steps but also the progress of the whole seismic compliance project. Now, one thing that this automated seismic compliance plan does is it allows us to track progress in a centralized fashion. So when I show you the tables, you will notice that a lot of steps are pretty interactive and also very transparent to everybody, so that tracking and transparency brings efficiency. I'll probably mention this maybe 100 times in this presentation. The compliance plan and the delay, those are both due 1/1/2026. Now, some hospitals are already 2030 compliant, so obviously they don't need to do anything because they're already compliant, so they don't have to go through these steps. Now, if a delay is approved for the facility, the delay is valid for the entire facility. But keep in mind that each building has its own schedule, but there's a final approved deadline. So we are not giving a delay to each building. We are giving a delay to the facility, provided that each building in that seismic compliance plan schedule is reasonably followed. Now, straight going into the definitions. In AB 869 high level summary, I mentioned these small, rural, and etc. hospitals. So let's go into the definitions of these hospitals. So when we say small, specifically what we mean is, or what the health and safety code means, a facility with 50 or fewer licensed beds. So this is not GAC beds, this is licensed beds. So the bed count is 50 or less. Rural hospital. So this has nuances in it. A rural hospital has two sets of definition. One is the Health and Safety Code 1250. This is the oldest definition. It refers back to 1982 census and some federal peer studies. So there's a static list about this. So there's about maybe 60 plus hospitals that fall under this definition of rural. And then there's a medical study service area, MSSA. MSSA has three definitions: urban, rural, frontier. Urban is urban, rural is in between, frontier is like really the population is very, very low. So we Health and Safety Code combines rural or frontier into the rural definition. Healthcare district hospital. Again, this is pretty straightforward. If it's a district hospital, they are in the potential list. Distress hospital loan program recipient. Again, there was a loan program that happened recently. So these are the financially distressed hospitals that got loans recently. But this definition also includes future program recipients. So if you're not a recipient today, but if you become a recipient in the future, then you will be eligible. Critical access hospital. Again, these are the certified ones by the Secretary of the United States, Health and Human Services. All critical access hospitals are rural hospitals. Not all rural hospitals are critical access hospitals. So there is about 30, 40 critical access hospitals, maybe 10, 15 distress loan, about maybe 40-ish district, and 70 to 100 rural, and I don't remember the small, but when you combine all of these, there is about 130-ish hospitals under the combination of these definitions. So one hospital can be a district and rural, or a critical access and DHLP recipient. So there are like multiple combinations. Okay, so how do you know where you are on those definitions? So basically, what we did is we put our entire list to our website. So I provided the link here, report.hcai.ca.gov. You go there, you click on it, and then you're gonna see go to our report center. So choose Office of Statewide Hospital Planning and Development. And then right after that, choose 869 eligibility summary. When you press go, it tries to generate a report for all of those hospitals. So wait 5 to 10 seconds. So as soon as you hit go, you're not gonna get anything right away. So if you're patient for 10 seconds, you're gonna see a list like this. So this list shows facility, county code, MSSA, rural or frontier. So again, this is our analysis. If you see any discrepancy, let us know, we'll correct it. I'll come to rural 80 beds under 75 million later. This is a small definition, beds 50 or less. This is another rural definition. This is District Hospital Loan Program. Compliant 2030 means that, yes, they are, for example, rural, but they're already compliant, so they don't have to do anything. MPC submittal, as far as we know, if you submit it or not submit it, and a district, the designation. So take a look at it and see where you are and where everybody is on the designations. Again, being on this list does not give you automatic extension. This is basically the potentials. Then there is an application process to vet if there are any exceptions that disqualifies these facilities. All right. Rather than going through some paragraphs, I'd like to basically give you the whole process in a flow chart, so that when I'm talking about some individual items, things maybe will make a bit better sense. Okay, so is the hospital small rural district critical access or recipient of the distress hospital loan program? Basically, when you go to that table, are you there? If it is no, then unfortunately that is not accept or you are not potentially eligible. But if you think that you are eligible, we'll reconsider that. Just 1 second. The other one is if you are in that list, has the facility submitted MPC report by 1/1/2025? If it is yes, then we go to, does the facility need an extension beyond 2030 up to 2033? Then the delay application not required. Because if you don't need the extension or if you don't need delay, it is you don't need to do the delay application. If it is yes, then the question is, well, have you submitted a compliance plan? And if there's no compliance plan provided, you still have till 1/1/2026 to do that. So it's basically going back to and finishing that. The lower part of the flow chart is continuing from the compliance plan. So this is a bit tricky one. Does the hospital belong to integrated healthcare system with 2 or more separate licensed hospital facilities? Basically, what this means is, let's say you are part of a chain like Sutter's, Adventist, and so if there are 2 or more hospital facilities in the system, let's say that's the case. If that's not the case, if you are a standalone hospital, then yeah, you are eligible to apply. But if you are a part of a system, then there are some conditions. So there are 4 conditions that may keep you in the eligible list. So one of them is if the entire healthcare system is in financial distress, then you are eligible. So there are documentation required to justify the entire integrated healthcare system being in financial distress. The second item where it keeps you as eligible is if you are a rural hospital with less than 80 general acute care beds, not licensed beds, GAC beds, and the revenue of the hospital is less than $75 million in the year 2020, not current year. It's basically the finances are locked back in 2020. So the table that I showed earlier has our analysis that we looked at the 2020 finances and we made some judgment. But again, let us know if our analysis is inaccurate then we'll basically ask for supporting documentation. In the healthcare district hospital that does not have contractual management lease or operating agreement with the health system that imposes upon the health system any financial responsibility for the healthcare district infrastructure cost for compliance with this section. There's a lot of words, so I had to read this like 15 times to understand what this is about. Basically, what this is saying is, let's say you are a district hospital and you are responsible to pay for infrastructure costs, the seismic compliance upgrade. So the district is paying for or funding the upgrade, not the system. Then they are eligible. And this one is a pretty narrow definition. A hospital that is part of a system that is operated by the district or a nonprofit corporation that is affiliated with the healthcare district hospital owner by means of the district status as a nonprofit sole corporate member. Again, I talked to our lawyers, so they mentioned that this is a pretty narrow requirement. So it is there. So if you think that you fit to this definition, you will be eligible. All right, so since the text in the previous boxes are pretty small, so I put this as the text, and I won't read this one. This basically says the same thing. Okay, so let's say with the table that you used and the flow chart you followed, now you know that you are eligible or potentially eligible. So what do you need to do at this point? So first of all, the first thing is working on seismic compliance plan and the delay application. So the seismic compliance plan is truly a big high level what you want to do with each building. Do you want to upgrade? Do you want to remove from general acute care services? Do you want to demo it? Do you want to build a new hospital? Like, what is the solution for each building? And what is the timeline that you can achieve that solution? So it truly requires an in-house talk about the overall strategy of the facility and where the seismic compliance fits. I would definitely bring some professionals about how long some construction takes so that it gets built into your estimated timeline. So although the seismic compliance plan is just 2 tables with a few dates, it's easy to say, but the thinking, the strategy, the discussions behind it is a lot. So once you figure out what is in front of you for the requirement, then you can start thinking about, okay, do I need more time to achieve the compliance? And that's where the delay application to HCAI comes into picture. The application is truly just one date in the application and the supporting documents. So once you've figured that out and submitted to HCAI, the goes into review and approval. Let's say we approve it, and you start doing the construction, implementation, the design team, the contractors are working on it, and let's say the progress is on track. And time to time, we ask you to update the compliance plan that you are on track. And basically, there are some options saying that, yeah, we had this milestone, we met this milestone on time, and then we will just field verify whether that is happening, and then we will keep updating the compliance plan. It's not like every day you update it. There's about maybe 6 months, a year. So there's some period, or whenever there's a big change, I would go ahead and update the compliance plan. But let's say while doing this, things started falling behind, the progress is not on track, let's say. Well, in that case, still, you should go back to the compliance plan and update it with the revised proposed dates. So, things happen, observed conditions, change in financials, budget, there are a million reasons where this can be the case. So, but when you update the dates, does that truly change the final date, final extension delay date? So that's the question. If you're still within the, let's say you ask for 2032, and the work is still within that time period, but you are now changing the milestones, then if that's the case, then you just need to update the compliance plan, we review it, good. But if you start seeing that, okay, with this delay, it's gonna have this domino effect, and it will basically, there needs to be a new delay application because the final date is different. So if that's yes, you go back, you change your seismic compliance plan, you change your extension application, we review, and the cycle continues. So that is the whole process. Now, in the next many slides, now I'm gonna go into the seismic compliance plan as well as the extension application step by step. So we will start with the seismic compliance plan first. The reason is without having this, it is not possible to ask an extension, because extension is about, this is how much time I need for this scope. So so that's why it's important to start with seismic compliance plan. Okay, again, I'm gonna start with what it is not. Seismic compliance plan is not a drawing or calculation or evaluation. So because people see the word plan, they think about drawings. No, it has nothing to do with that. It's the overall direction for each building. Seismic compliance plans outline the details of how each building in the facility will achieve seismic compliance by the proposed completion date. So it gives us a bit more details about building by building. So again, the information includes, okay, are you gonna retrofit? Are you gonna remove general acute care services and things like that? And we ask for the timelines and related project numbers. So if you have any. Again, the seismic compliance plan, the current code says that, okay, if there's any change, you have to reapply. But again, this compliance plan requirement has been there with the first deadline 2001, and I can tell you that we have not received much updates in the last 24 years. And that's why we are also putting this new deadline with the update so that we will be all on the same page. Now, with the seismic compliance plan, the information that we are asking today is actually the same information that has been in the books, in the requirements, in the health and safety code, in the California Administrative Code. So we are not asking anything more. So it's already in the regulations. Well, we are not changing it. What we are changing, again, from 2001, the first deadline of submitting seismic compliance plan, where it was a paper submittal. And then over the years, we went into electronic submittal with the PDF, where people, put all these tables in a document, scan it, send it. Now, 2025, the process is now changing to automated submittal. So again, the requirements are the same. The process is much more interactive. So nothing new. We published, or about to publish today, our application step-by-step on the ESP user guide. So user guide 21 basically goes through step-by-step process on how to apply, how to make a user profile and things like that. So these are live links, so it should take you to the document. Now, I kept mentioning there are two tables. So there are two tables in Seismic Compliance Plan. Number one is what we call Compliance Method Table. The other one is Building Milestones Table. So Compliance Plan Method Table is, as the mention says, it's the method: retrofit, replace, demolish, things like that for each building, very high level. Building milestones, this is more the dates and scope for each building. So we have two categories under the building milestones. We are separating what we call a regular milestone and a critical milestone. So I'll come to the differences between those two different milestones. And the rest of the application is our standard questions, like when you open a new project. It's just the same ownership or applicant info, the design professional, etc. So that's really all about this whole seismic compliance plan. Now, going to those tables, the first table, the compliance method table. This is the final outcome of that table, and that table asks these information. Now, the building number, building name, current SPC, MPC, they will be all auto-populated for you. So when you actually put a new application and when you come to the window, you will see that all of the buildings under our inventory will pop up here. So, and then the question will become for each building, okay, what's your compliance plan, compliance type? And these will be your options. Again, these are pre-populated or drop-down menu. So you can choose one, a little narrative about it if you need to explain what this is about. And if you have seismic compliance related project numbers, you can put that in. And when we HCAI review, we may have some comments. And rather than giving you a big letter, we're gonna basically put the comments right next to where the building is. So you're gonna see our comment right next to where you basically input information. Again, it should be pretty short comments because again, everything is super high level. The other table is the building milestone table. Again, these two tables they're the heart of this whole entire process. So in this table, let's go through some item by item. Building number, again, pre-populated. Milestone type. So for each, there will be 10 lines for each building, and you're gonna be you will be able to pick and choose one of these drop-down items. So your milestone, okay, are you going to talk about evaluation report submittal date or construction project submittal date or the permit issuance, some construction milestone, 4D permit issuance. So there are like many options on the milestone type. So you can put a little description about it. And then you need to identify whether this is a regular milestone or critical milestone, which I will talk about in my next slide. And the most important thing is your proposed completion date. And if you completed that in the later update, you can come back and say, yep, it's completed. If when you put it in, obviously it needs to be in progress, but when something happens, you submit it and the date is now passed and you can come back and say, yeah, it is completed. If you know the project, if you've submitted a project, then you should know the project number. So you can put all the related project numbers. And if we have a comment about this line item, we will put it right here. And when we accept it, approve it, you're going to see some determination at the end. Now, again, 10 lines per building max. But if I step back from the table environment and put, let's say you put all that information and you visualize what each building is doing in your big schedule. Let's say this is your timeline, 2025, and the amount of application up to 2033. And the initial delay application asked for mid 2032. So that's your ultimate delay point. But your building one, according to your schedule, the scope items will start mid 2027 and it should end around here. And you have many milestones that you put in. So this is your duration of what you're going to be working on building number one. Now, in these milestones, you can pick two important milestones that what we call critical, and the rest are regular. Building two, similarly, it has a different start and end in this whole facility construction schedule planning. Many milestones that you put in, and you pick two. You don't have to pick two, you should at least pick one. It can be more, but not the total number should be 10. Building three has a much longer timeline. So when you basically translate all the critical milestones down, what you're going to notice is the critical milestones should be about equally spaced. So why do we do this? The reason that we are doing this critical milestone concept is to truly gauge is the facility on track to achieve the several items. So again, just achieving building three is not enough because you have all other buildings. But if we put all of those milestones, some will be behind, some will be ahead, it's going to be very confusing to track. So that's why there's a critical milestone concept where you choose about equally distanced from each other. So if we are, let's say on 2026, end of 2026, right, let's say we are here, and if you met this milestone, so maybe you didn't meet this regular one, you are working on it, you are kind of a little behind on building three, but you are not behind on building two. So you will look, again, like you are still on track. But when you start, when this building three really is behind, then we're gonna start seeing that, okay, this is not progressing. We may ask questions, or you may ask your design team, why is this delaying? Because when the next critical milestone hits on building three, then the progress will not look like it's progressing. So be mindful on how you are choosing your critical milestones to truly reflect the critical path of the construction. So there's no like a magic formula about which ones to choose. It's a judgment call. Again, we are trying to pick the important ones that is truly truly has effect to the final deadline. So that's critical versus regular. Now, with that in mind, we'll go to step-by-step application process for the seismic compliance plan. Again, I mentioned two tables and the contact information. So we're gonna just go through it, hopefully a little bit quicker. So on our ESP, e-services portal, you go to, you log in, you go to enforcement and create an application, and you hit continue application. So now it's it shows compliance plan under the enforcement compliance application. So you click on that one. If you already applied one, then you can search applications, but this is for creating a new application. So it's compliance plan, then you hit continue application. So here where you can input your facility information. Once you put your facility number, then it finds the facility information from our database. It pre-fills, populates all the name, region, type, address, everything. So all you need to do is put your facility ID. So address and everything should be pre-populated. If you see any discrepancy, let us know. We'll correct our database. And after that verification, you can continue application. So I want to pause a little bit here because in the contacts, choosing the contact is important. Now, in our system, when you put a contact, and not just for this compliance plan application, but for any project, when you put a contact, please make sure that that contact is on the project. If there's a change in the contact, when we send responses, remarks, letters, or whatever, that will go to that contact. We won't know whether the contact is there or no longer there, or so please update the contact if there's a change. Again, this is valid for all projects with HCAI. A lot of times when we send the remarks letter, the facility say, we never received the remarks letter. Well, you did receive the remarks letter to the contact that you no longer had. So that, again, we cannot know who's present on the other side if you don't update the contact list. So additional contacts, you can put those in. Licensed professional, again, these are not requirement, but you can put these different types, but we need to have at least one additional contact. So the next item is the property management questions. Let me see, I talked about this. Yeah, one additional contact. Licensed professional list. Oh, in the licensed professional list, you can look up a licensed professional on our database. And if you don't see that one, you can ask to add. Okay, property management information. So this is an information that we have some parts and pieces in different places, but we don't have all the information for all hospitals. So when you apply for a compliance plan, we'd like you to answer a few questions. One is about the owner. The other one is about the operator. So sometimes those are different. So the owner may not be the operator, vice versa. So there are different types of owners. So there are private owners, investors with different designations, nonprofit corporation, city, county, district, and UC. So again, the information is all dropped down. You just pick the right one, and we'll ask for the owner name and as well as the managing organization and licensee name. Again, we are trying to also figure out, who is responsible for funding the seismic compliance plan, and that question comes last here. Who's financially obligated for infrastructure improvements, including seismic upgrades? So the compliance plan is nice, but we need to know who's actually funding this effort. Now going to the table that I showed, and the next few steps will start outlining how to input those information. So compliance method and building milestones. The compliance method, the first table that I showed, there's a little action edit button on the right. So you can hit and edit per building per line, or you can select all the buildings, and when you hit edit, select it, then it will show all the buildings, and then you basically edit in one run. So you can do one by one, or you can do all of them so that you see all of that in the same window. So each item has, some of them are pre-populated, but each item has the drop down if where applicable. So choose the right drop down, and please provide a little narrative just to make sure that there's no misunderstanding about what you are trying to achieve. And we'll ask to include project numbers as much as possible. When you need to do multiple project numbers for the same scope, semicolon, you can put it in between, and you can list several project numbers. Our system will recognize when you follow this format with different project numbers. All right. So the other one is the building milestones. As I mentioned, it comes with 10 lines per building, and the window, the application window, you will notice that it is designed such a way that it only shows one building per window, 10 lines. So when you go to the next window, which is the second window, actually that's the next building, 10 lines. So it's fixed. So if you see like 13 windows, that means that you have 13 buildings. So you can put up to 10 milestones each, and you can edit actions. You can select all of them, then you can put all of those milestones in one go. So truly, I mean, that's really it's really about it. And this kind of shows the same information about where you put it. Sometimes, depending on what you choose, some of the items become required. So when you choose some options, some items will basically become optional. Next item is the status. So again, in the milestones, when you say, okay, we're going to submit an evaluation report by this date, when that date comes and passes, we would like you to update that status. Have you completed it, or have you not started it? So, so this will again is self-tracking with verification. So again, you're gonna come back to the seismic compliance plan pretty frequently when a lot of things are happening. So please keep update this as much as possible, as frequently as possible. Okay, now as I mentioned earlier, there's a critical milestone column here. So this is where you put yes and no. So you choose the critical milestones by thinking all other buildings in the campus. So it will be good for facilities to have like a master schedule plan in front of you to see where everything is, and then keep track of it and choose the critical milestones. Again, critical milestones are very important because they are also tied to fines and permit blocking. So regular milestones kind of show you know, what's going on, how late are you per building, but critical milestones now start getting into finable or permit blocking phase. So again, please keep a closer look at the critical milestones. Now, what if you have like 25 buildings, and what we are asking is 10 critical milestones? Now, that's where you need to start choosing the important buildings or critical path buildings versus the other ones, such as like canopies, tunnels, sheds, equipment yards, or buildings that are not as important or significant. Then you don't need to put critical milestone for that building. Again, it's a judgment call. Again, we are trying to reflect the overall progress with the concept of critical. So choose your biggest buildings with or the biggest scope of work. So those are our target places. Attachments. For compliance plan, for now, there's really no attachment required. But again, we put that in just in case there will be some additional questions or we don't know what it can be at this point, but it is there just in case we need it. So compliance plan right now should not require any attachment, but if something is asked, maybe you can use this one as the vehicle to put that in. Now, similar to construction projects, there's a facility pin. So it's basically we consider that as authorized person who knows the pin, because if you don't have the facility pin, you cannot submit it. So again, very similar or same as the construction projects that you do all the time. So again, this follows the same concept. It has time and materials, so I'm not expecting much time that will be spent, but after review and right before approval, there will be payment phase. And then right after it is accepted, basically it's approved. Now, what if after this happens, you want to make a change? Or you want to update the status, or like how do you go back? As soon as we approve it or remark it out to applicant, you're gonna see an active link. In this case, we let's say approved it, and then now it goes into amendment mode. So you can amend it anytime, right after the approval. Now, one thing that I want to point out is the record number. So the compliance plan application has this format: CP compliance plan dash your facility number. So that will be your record number. And there will not be a new record number. It will be always be this number. So when you amend it, it will add dash temp, and you're gonna make your changes. And when you submit, we review it. And after we review it, if we approve it, then it will go back to this number. So the approved items will be this. The previous item, the previous application, will become a historical application with the date attached. So if you amend 10 times, then you will see 10 historical applications that you can go back and see what you did, what you changed. So it's pretty user-friendly in terms of changes, and you can always go back to see what happened. So with that, that concludes the seismic compliance plan application process. And next, I will go to the delay application process. So I'd like to give 5 minutes break for um, for everybody to stretch, and we'll be back in 5 minutes. Okay, similar to seismic compliance plan overview, I want to do a quick overview of the delay application. So the delay application is very, very simple. We basically have one text box that says, what's your requested delay deadline date? And then there are required documentation as an attachment, and I'll come to that one. But in terms of inputting an info, it's just basically one text box. The other items are similar to the compliance plan, the contact info, facility ownership, and things like that. So nothing complicated. So with everything, we have a user guide for this. We keep improving the documentation, better visualization. So we just rolled out this, so you're gonna see additional improvements on all of these processes. But again, the fundamentals are remaining the same. Just the visualization and maybe some examples will also follow. This delay application, as I mentioned in the beginning, we have 120 days, but I want to emphasize the 120-day limit. This is not when you first submit and when you finally get approval, because we approve it when the required documentation, or we start reviewing it when the required documentations are submitted. Sometimes the facilities start the application, but they never put the required documentation. They wait 6 months, and then later they come back and give everything and expect same day turnaround. So the idea here is when you give us all the required documentation, we are putting 120-day approval period, a review or a decision. So it should take a whole lot less than that, I can tell you that, but that's what we are shooting for. So the delay is asking a deadline not beyond 2033. So, and this again should match with the proposed completion date of the seismic compliance plan. So all the planning that you did here, the outcome of it will go into the delay application. In the delay application, we are asking you to provide a super brief narrative explaining the need for additional time and detailing the efforts towards compliance. A lot of times there will be some financial documents where it can start with the narrative, so it can go into the same document. The verification process of being a standalone facility will be basically verified by some of the documentation. So that's a pretty typical documents that every facility has. Now going into some bit higher level required documentation, and it comes into picture when the seismic the eligibility is asked through the financial distress at a system level. So if you're a system with 2 or more licensed hospitals, and if you want to take advantage of the eligibility, then the requirement is show us that the entire system is in financial distress. So, um, and if those documents do show financial distress at the moment, we'd like you to update us in the status of the financial situation every 6 months to um, basically make sure that the situation is still ongoing. And if the financial outlook changes, then you basically notify us, or our analysis will start showing that the, the things are improving, so that we sit down with the facility or the system to talk about the revised timeline. So to make things more organized, we put 2 dates, February 1st and August 1st of each year for reevaluation if you are taking a system level financial distress. Again, we will work with you on this aspect about what is acceptable and how we can work with your parameters. So there are some set things that we are looking at, and there are some things that will be case by case. But not only what you are in today, we'd like to also hear about the 2-year cash flow projection. So basically, it's kind of a forecast towards the future, so that it's not just today, um, like what is coming in the near future. In pin 80, we put some definitions on the expectations, so such as days cash on hand, or the current ratio for current assets versus liabilities, the operating margin, net cash runway, and debt service coverage ratio. So these things will help us understand how much distress that you're in. And these parameters are also similarly used in the distress hospital loan program. Not one-to-one scenario here, but we have a pretty strong financial team at HCAI that will look at these things. If eligibility is due to the clause, a rural hospital with fewer than 80 beds and less than $75 million revenue in 2020, basically, first, check our website, check our table first, and see if you were at least identified as one of them. And you can, I also put a link here that will go to the details of that data, that financial report data on our data portal. So you can look at that, find all facilities really, and their financial reports. Everything is public record. And if you feel that there's a discrepancy in those financial reports, that we have it on our website, or if there's a discrepancy of our conclusion of the financial report, please let us know. Talk to us. We'll reevaluate our initial analysis. So we looked at some parameters in those financial financial reports. So basically, the revenue, the calculation of the revenue, what we did is net total revenue and other operating revenue. So we summed them up in the audited financial statements compared with $75 million limit. If it is under, you are there. If it is not, and if you don't agree, let us know. In the delay application, there's a 2 additional year delay provision. So, and it says that continuing financial distress. So again, the key word here is the circumstances beyond the hospital's control. So this 2-year delay, up to 2-year delay, is on top of 2033 deadline. So again, we are looking at case by case, how the progress of the current projects are going, the current situation, the upcoming scope, and the conditions that the hospitals are facing at that time. So it's truly a future condition to be determined. Now, since this is about future status, like continuing distress, we will start looking at those 2-year delay after January 1st, 2030. So when you start going into the actual or the original delay between 2030 and 2033, we will monitor the case. So we are in 2025, so 8 years from now, it's going to be 2033. So the 8-year versus 10-year, we can't make the judgment right now because we need to monitor how everything is going. So we will be looking at the additional 2-year delays after January 1st, 2030 to see that if you need 5 years rather than 3 years at that time. So the applications using the same application that you do this year. So there's no new application. You're going to just revise the application at that time. So we will be asking again, what are the factors? Give us a narrative. But it's not just giving a new date. If the seismic compliance plan need to be updated for the conditions that are ongoing with the new milestones, maybe new scope, new direction, whatever the case in the future, that needs to be updated. But again, those will be after 2030 or after January 1st, 2030. So the other question is, okay, in all of these, what are we gonna do with the current MPC deadlines for the delay? So let's first go through our current deadline dates. So January 1st, 2025 is the MPC 440 and 5 evaluation submittals. March 1st, 2026, the owner shall submit construction documents for MPC. March 1st, 2028, the hospital shall obtain a building permit. So up to this point, and some of you may realize that, wait a minute, this was January 1st, 2026, January 1st, 2028. Why is this saying March 1st? With the 2025 code, we pushed it 2 months into March 1st because it has been, how to say, painful to get January 1st submittal when a lot of people on the designer side were missing, and submitting after the New Year's party was not quite fun. So we put 2 months into the year so that the whole delivery submittal chain is available. So March 1st, 2026, March 1st, 2028 is there. Now, with the delay application, these dates won't change. So these are all planning, design phases. So the delay will give you additional time to do the construction. So I want to emphasize that the permit date of March 1st, 2028, like right before permit, you have plan approval. So there are some additional time allowed between plan approval and start of construction. So there's a 1-year time allowed before starting construction with an optional extension of 1 additional year. So we are getting pretty close to 2030 just for the design. So again, the facility needs time to construct, and the delay will be in those dates. So hopefully it won't take that long to get to the permit level. But if it does, the current deadlines do still apply. Then, do we have a new SPC deadlines? The answer is no. We don't have a new deadline for SPC. The SPC, the final date for SPC is the final date of the approved delay date. So people will say, okay, why don't we just do the same dates with MPC? SPC projects have a different uh, diff different steps. It doesn't quite exactly line up with MPCs. So it's a good idea to do construction when you're doing an MPC construction. It's a good idea to get all the SPC items in, so that that basically is a lot of efficiency and saving money. So, but putting an SPC deadline which is not in the same steps of MPC will only create inefficiencies along the way. So what we are expecting is, when looking at MPC deadlines, please plan out SPC items to see if you can fit those construction items in the MPC construction phases. So one has to fit the other, but we can't fit two things at the same time. So that's the idea. Now, in the AB 869, there has been some modifications to small and rural hospital relief program. I went into great detail in the previous webinar, so I encourage you to go and take a look at that one. But in summary, the idea here is AB 869 further focused the program to SPC 4D scope, and it also expanded the hospital types that can seek opportunities under the small and rural hospital program. Specifically, it added distress hospital loan program recipients and the district hospitals that seek delay under this section. So again, AB 869 did not disqualify anybody. It just added more into the program, but narrowed the focus to SPC 4D and related items. So there are grants still available. So I again highly encourage you to go to the slides and apply if you are one of those small rural and district and distress hospital loan program if you are seeking delay. If you're not seeking delay, just being small and rural is acceptable under SRHRP grant program. We put the new items, new or more focused requirements in our regulations, as well as PIN 80 shows all the regulations that is approved. So you should be able to find it in Appendix B. Okay, next item. Now I'm gonna go into step-by-step the delay application. So similar to compliance plan, you go to ESP, and instead of enforcement, you're gonna go to projects, and you will select seismic compliance application for seismic extension SPC. Although the extension applies to SPC and MPC, this is the category that we have been historically using for the deadline revisions. So we are still using that, so choose that. Similar to the other one, once you put the facility ID, it should pre-populate everything. Contacts are the same. So I'm not going to go through the same items again. Again, super straightforward. Fill in the applicant and contact list. At least one applicant and one contact shall be included. Again, I want to re-emphasize, please keep an eye on your contact list. So please update us when there's a change. Contact professionals, same way. Again, licensed professional is optional. You don't have to have a licensed professional to do this application. Okay, so you can include project name. You can say a delay, AB8669 delay, and a little super brief narrative here. Extension type, you're going to choose AB869. Let's see if I show it in the next slide. Yes, I do. Again, thanks Kamal also helping me with all of these slides, and Kelly and many people. So this ASI request for seismic extension, choose AB869. Requested delay. And the next item is it kind of blocked on the next one. There's a text box that basically puts the deadline. So it's just one place. All right, this is where the attachments come into picture. So all the new or the required financial documents, etc., will be attached here, and our team will review and get back to you if there are any comments. So again, a narrative is important to help us understand the situations that are happening. So I mean, looking at numbers is one thing. Hearing as the big summary, it really helps everybody. So highly recommend to include a good narrative if you are seeking different aspects of the eligibility or the delay. Again, if you don't have a facility PIN, you cannot apply or finish the application. You can start the application, you can prepare all of those things, but you will not be able to submit. So again, that's by design. Only the facility authorized people who know the PIN can put the application or submit the application. Similarly, there will be some review and time and materials, and hourly review. And once it's confirmed, it's going to get this number, and that will be the end of delay application process. The the adjustment to schedules. So this kind of applies to both the delay AB869 as well as the seismic compliance plan. So adjustments, changes will occur. We know that because there are, again, this is a long-term project. We are not talking about a couple of weeks. We are talking about years. So there will be changes. The important thing on these changes is keeping us basically informed, and we will also try to keep you informed on what we are seeing. So we highly recommend all facilities and all systems to have periodic meetings, like maybe every quarter, to help us understand your progress, as well as we can explain if there's any change or how we are seeing things, or if there's any misunderstanding it will be super important to have those meetings. So we are hoping to uh, put meeting times on our calendars um, as a start, and so that it will be on our calendars. And if there are items to talk about, we keep the meeting dates. And if there's nothing new, then we can just cancel those meetings. So I highly recommend doing that. A lot of systems and facilities are already doing those quarterly or sometimes monthly, depending on the needs, those meeting times. And we highly encourage everybody um, to basically put down some regular meetings. Again, we want you to be successful. We want you to get there. We do not want you to spend resources, time, money for the items that are not required. So we are not shy talking about if we see something more than needed, and the other way around as well. So again, communication throughout this whole process is the most important thing. There will be misunderstandings. There will be things that deviations happen. So communications will clear those things up. So again, things happen when there's a change. We need to start changing the plan. And we are requiring 30 calendar days before any delay schedule changes. Um, so what we don't want to end up with is, oh, we are late for 6 months. We never told you. Now we want to change the schedule because we are 6 months late. So we want to be more proactive. So please let us know ahead of time so that we try to um, adjust efficiently. So um, what if the deadlines are not met, um, and the schedule slips and you are missing the milestones? Again, the first step is, can we put you back on track? Can we find a way to adjust the schedule so that it is back to something doable, something reasonable, something achievable? So work with us. But there will be times where, again, we see some of those in AB 2190 program, where the facility is not responding any of our um, reaching out efforts. Some of them are straight basically telling us that we're not going to do anything. So that's where we kind of uh, lose all the options and go into the assessment of fine route. Again, we do not want to take your money or anything. That those money should be used for healthcare. So this is kind of a place where there's no path forward that is being seen. So the fine starts coming into picture. Now, the continuation of no progress, um, there's a second level of enforcement action where blocking permit. So in this case, blocking permit is not just for that building, it's blocking permit for the whole facility. So again, we do not want to go there, but again, work with us. We will try to get you back on track to see how we can help and basically make this a success. So if the building permit is blocked for the entire facility, then there are exceptions to that block. Then those exceptions are maintenance, emergency repairs, and the projects about seismic compliance. So all other projects will be blocked from permit. It doesn't mean that you cannot apply. You can still apply. We will still review. We may still approve the plans, but the permit will not be issued. So that's the accountability measures. Now, while we are doing all of these, excuse me, we will publishing a lot of this information on our facility detail page. So again, we already have a lot of information per facility, but this is the perfect place to put the compliance plan there. So if you go to our facility detail page under HCAI, there are many tabs, and the next tab, when you submit, it will appear as a seismic compliance plan, and it will show some visualization, your critical milestones, your non-critical milestones, how you are on the progress. So there will be some filters, whether you are meeting your critical milestones. So it's going to be quite transparent and hopefully understandable. So we will keep improving that tab to make it more user-friendly, more visualization aspect. So that part, pretty excited about it. So we have quite a number of projects that are ongoing. So you're going to see a lot of good improvement on presentation to the public, and we'll keep updating that. With that, also this page will show some of our comments, like if it is remarked, if it is approved or denied. So we'll try to be as transparent as possible. So when the seismic compliance plan is submitted and denied, we also want to put here about what the denial is, and what the timeline of that denial was, and why we denied it. Or the other way around, whether there's a remarks or approval, it will show all of those completion dates and milestones and compliance methods. With that, I think this is it. So if you have any questions, as Kelly mentioned in the beginning, you can email us, you can call us, you can meet with us. So again, thank you for attending this webinar. Again, we'd like to make this program a success altogether, and I believe that we'll get there. Thank you so much.
This
Kelly?
brings us to the end of our presentation. We hope you found this webinar to be helpful. Please remember, if you didn't download the PDF handout, you may do so now by going to the handouts section of the GoTo panel. Alternatively, the slide handout will be available on the HCAI website in approximately 1 week. Also, today's session has been recorded and will be available on the HCAI website under Building Safety and Finance, Training and Education in approximately 2 to 4 weeks' time. If you have any questions about this presentation, please email seismiccomplianceunit@hcai.ca.gov. It's been a pleasure being with all of you today, and thank you for doing your part in providing access to safe, quality healthcare environments throughout the state of California. Have a good day.